society and dear students. On the behalf of Pediatrics, I, Dr. Priyanka Trivedi, welcome you all in the sixth session of National Lecture Series on Comorbid, planned and organized by our Jiva Committee. In this series, today we have lecture of one of our eminent speaker, Honorable Dr. Shrinidhi Kumar sir from National Institute of Ayurveda, Jaipur. And today, sir is going to deliver the topic entitled Ayurvedic Understanding of General Principles of Drug Administration in Childhood Clinical Practice, which is, we can say, the foundation topic of comorbid practice. And I'm sure that this lecture will be so much meaningful and helpful as well as beneficial for all. Previously, we got chance to hear five eminent speakers of comorbid field, and today is the sixth session of this whole series. And this all became feasible just because of tireless effort of our Jiva committee members. And hope in coming time we will get chance to hear many more learned persons' experience of comorbid field. So on the behalf of all, I would like to thank all the members of Jiva committee who made this possible. Other than this, for the sake of information to all the members, I just want to share that our organization is also available on social websites. You can connect with us on our Facebook and Instagram page too. We have our YouTube channel where all the information and lectures are also available. So kindly go on and subscribe the channel and do like our Facebook page. With these words, I would like to request Dr. Lakshmi ma'am to take over the mic and proceed further for next part of the session. Dr. Lakshmi ma'am. Dr. Lakshmi ma'am.
Hello, Dr.
Hi,
Priyanka.
yes
Am I
ma'am.
audible?
Yes ma'am. Over to you ma'am. Thank you ma'am.
Thank you. Thank you, Dr. Priyanka. Hello, and good evening to all the respected teachers, faculty members, and dear students. Team Jiva Committee, National Kashapa Society of Ayurvedic Pediatrics, welcome you all at this academic platform. In the continuation of the online lecture series, today you all are going to attend the sixth episode of this series, and the eminent guest speaker who will share his expertise is Dr. Shrinidhi Kumar Acharya sir. Before to start sir's lecture, I would like to throw some light on the sir's academic achievements. Dr. Shrinidhi Kumar Acharya sir is presently working as assistant professor in Department of PG Studies, National Institute of Ayurveda. Sir has completed his undergraduation from SDM College of Ayurveda, Udupi. Later, he pursued his postgraduate degree from IMS PHU. Sir is also PhD from Rajasthan Ayurveda University, Jodhpur. He has got about 16 years of teaching experience of both undergraduate and postgraduates of Ayurveda. He has about more than 6 years. He is involved in about more than 6 years, active in many successful health programs launched there in Hassan. He is also involved in research activities since last 16 years and guided more than 20 research scholars at postgraduate and PhD levels. He also extended his services as examiner, paper setter, member of inspection committee, etc., at different universities and delivered more than 30 guest lectures at national, international seminars, CMEs, and workshops. He has the credit of publishing more than 40 research articles in various international, national, and peer-reviewed journals. Sir also authored the popular textbook of Comorbid titled Acharya's Textbook of Comorbid in 2 volumes and gets published from Chaukhamba Orient area, Varanasi. He is also involved in Ayurveda awareness programs, and his programs were telecasted in Doordarshan, ETV, and radio. With this brief, I request and welcome to Dr. Shrinidhi Acharya sir to share his knowledge and experience on the topic Ayurvedic understanding of general principles of drug administration in childhood clinical practice. Over to you, sir. Kindly share your views on the given topic. Sir. Sir, can you hear me? Dr. Sarita, sir has joined now. I think he got disconnected, I think. Earlier he was here. Yes, sir. Got this. Yes, sir. Get disconnected, I think. We should contact him. Hello. Uh, Again, again, again disconnected, I think.
I have called
Again
sir to join
disconnected,
again.
madam.
He
Again
will.
disconnected, I think. Let me contact him.
Yes, sir. Hello. Am I audible?
Yes, yes, please, sir.
Okay. Okay. So, shall we start? Okay. Respected Professor D. N. Mishra, sir, my seniors, my colleagues, and all my friends. Thank you very much for giving me this opportunity today. So, as decided earlier, so I will be going to talk on Ayurvedic understanding of principles of drug administration in children. Of course, this will be a general talk, and nothing new will be there, but some of the points will be highlighted. I will again confirm I am audible to all.
Yes, please.
Okay, thank you. So let us start with the presentation. See, the drug administration in children, the principles in Ayurveda. So when we discuss this matter, the first issue is always palatability of the medicine. Okay, so it is always palatability of the medicine is the biggest issue when you administer the drug in children. The first part is kids cannot be treated like small adults. This is the biggest mistake that usually the general practitioners will do. You cannot treat the kids like a small adult. In the sense, the rules and regulations which are followed for the adults cannot be followed for the kids in a half of its strength. For example, giving a tablet, one tablet for the adults and a half tablet for the kids. So this particular practice is wrong and this cannot be practiced in case of a pediatric. Drug dosage should be calculated as per the age of the child, or it can be the weight of the child, or in some instance like protein energy, malnutrition and obesity, etc. You have to go by surface area method. So therefore, you should not treat the kids just like adults. It may be in terms of physical maturity or it may be in terms of psychological maturity, because child psychology is completely different from the adults. So kids should be treated as kids and not as small adults. Now, second issue is administration of the medicine. Administration of the medicine is also the biggest issue. Because the routine form which we will administer for the adults, so that may not be admissible for the children, because children have their own limitations. And we have to change the mode of administration of the drug. Therefore, Kashava, the Charaka very rightly says, what he says, Madhurani Kashayani Kshiravati Mruduja. This is one of the important treatment principles which is mentioned. Leha Avalehascha. So here, Madhurani Kashayani Kshiravati Mruduja. So when he says, the drug should be Madhura Rasa in nature, Kashaya Rasa in nature, and the drug should be given with the Kshira. So we have to prepare the medicine in Kshira medium, milk medium, and then only it should be administered. Along with that, drug should not be too potent, Brodhoni should be soft, in a sense, it should not be more potent. So when he says this, so it directly indicates that, our point towards the fact that one of the best medium of administration of the drug for the children is Kshirapaka method. Whatever the drugs you want to take and prepare the Kshirapaka. There may be so many chunas, there may be so many other medicines. You mix all of them and prepare the Kshirapaka according to classical Kshirapaka method, and then you give to the children. And this is one of the easiest way of administration of the drug to the children. Okay, so although it is not directly told as Kshirapaka, this particular Madhurani Kashaya and Kshiravati Mruduja, it indirectly suggests that Kshirapaka is one of the best methods for the administration. Similarly, drugs can be also given in the form of the avaleha, or in the form of panaka, or mantha, or arka preparation can be given depending upon the condition and suitability. This is one important part. Second part, if you see, mix the drug or medicine with the eatable. This is one more easiest method of administration. We have to make certain modifications. We cannot be stringent or more disciplined in administration of drug to the children. And the drug can be mixed with the eatables. Now suppose we have got many chunas, and chunas can be mixed with the chapati or roti, or even the chunas can be mixed with the jaggery and madhu, and made into different eatable form like chapati, roti, or any other thing, uttapa like that. So that can be given. Okay, this is one more method of mixing the drug with the eatables. Now, one more important is about the kashaya preparation. Now we know that there are so many kashayas are available in Ayurveda, and these kashayas are quite good. They also give very good results also, as the evidence in case of adults. They also give a very good result. But the problem in case of children is we cannot administer the kashaya in children. But we want an instant relief, we want a very fast relief, and we know that kashaya is very good. But in spite of that, we cannot be able to administer the kashaya in the children. So here, one of the best way is what I used to practice is I ask the parents to do the kashaya, and afterwards, instead of going for spoon, I will tell them to use the dropper. Use the dropper, okay? Instead of giving the medicine in the bulk, you just go for the dropper, and drop by drop, you give the kashaya with a gap of 5 minutes or 10 minutes. Okay, so we used to give so many Jwarahara kashayas and also even Gujivati kashaya in this form. Okay, so dropper form we can use. That is compared to the other forms of administration, like by using spoon or some other measuring cups, etc. The dropper form is quite useful. Okay, this is one more method. Another one is about the Arishta and Asava. Now there are so many misunderstandings regarding this Arishta and Asava. First of all, the question will be asked whether you can give Arishta and Asava to the children. People have so much of apprehension regarding this Arishta and Asava, especially they are used in children. But there are so many myths. But I should say, as far as my opinion goes, Arishta and Asava can be very well used in children, and it is not dangerous. And all the apprehension apprehension over this matter is not true. Okay, of course, dose has to be calculated well and is to be diluted. That's a very important thing. Okay, see, the basic thing is Arishta. So many. I have seen so many physicians, so they don't prescribe the Arishta and Asava preparation, and they have got their own understanding that it may cause gastritis, sometimes it may cause sedation, sometimes some may even say it may lead to some habit formation like this. But all these things are wrong. When you're using the Asava and Arishta for the therapeutic purpose, you can definitely use it, but dose has to be calculated. Number one, number two, it should be diluted. And this Arishta and Asava act as a fermented food. You know that. It's a fermented media. Rather than whatever the medicine which is present inside, that is a secondary issue. Apart from that, it is basically a fermented media. We know that fermented media is always good for the growth and development or maturation of the intestinal bacterial flora. In children, we find so many atypical GIT problems, atypical diarrhea, atypical abdominal pain. So, in such condition, 1 or 2 drops of any Asava, not specific, any Asava you take, simply you take the Arishta, and 1 or 2 drops diluted with the milk, diluted with water, warm water, you just give it, it gives a good result. What I need to say is, it is one of the fermented media, and it may also act as probiotic. So therefore, Asava and Arishta preparations are one of the very hot cake of pediatric practice, and it should be given. And the myths regarding this Asava and Arishta are wrong. Okay. One more method of drug administration may be in the form of laddu and modaka preparation. Suppose 3, 4 or 5 years children, they are reluctant to take the medicine, we can make into laddu and as well as modaka preparations, and that can be given. Anyway, Kashyap has already mentioned that Ashana, Lepana and Pana, these are the 3 main modes of drug administration, which is quite good. And therefore, we have to akin our practice more to give the medicine in the form of Ashana or in the form of Lepa, that is external application, or different types of Pana. Next, administration of the medicine to a newborn and infant. Again, this is a challenging issue, we know that. But what classic says is, infants, the application of the medicine to the breast and made to the suck. This is one of the treatment principles which is mentioned, especially Kashyapa says that. You can apply the medicine to the breast and afterwards the baby is allowed to suck. This is for the newborn or infant, up to infantile age. Or another method is you apply the medicine over the breast and allow it for 48 hours, 48 minutes, that is 1 muhurta, and later you wash it and then you feed the baby. So this is one of the easiest way of drug administration has been mentioned for the newborns and as well as the infant. Now how far it is true? The question number 1 is whether the drugs get absorbed when you apply over the breast area. See, there are many 2 possibilities. One is whatever drug you are applied there, it gets absorbed and it is available in the ahara rasa of the mother, and through the ahara rasa, the upadatu of ahara rasa, the rasa dhatu, we know that it is stanya, and it is available in the, it is coming to the stanya, and through the stanya when baby suck the stanya, through the stanya the medicine will enter into the medicine will be accessible to the baby. This is one issue. Second issue, when you that is when you allow for 48 minutes. After application, when you allow for 48 minutes, there is a very chance of absorption, and this is possible. Another one is you are just applying and immediately you are allowing the baby to suck the breast milk, and along with the breast milk sucking, baby may also sucking the medicine which is applied there, and it goes inside. 2 issues are there now. As I told already, see, most of the drugs which are entering into the ahara rasa. So they will go into the rasa dhatu also. So the rasa dhatu, the upadhatu of rasa dhatu is that is sanya. So definitely it comes to the sanya. Now how far the medicine pass through the sanya? Now as per the modern science, almost all the medicines, it may be Ayurvedic medicines, any other alternative system of medicine, whatever giving is passed through the sanya. But the amount will go into various. Suppose if we take the example of antitubercular drug. Okay, so mother is taking antitubercular drug and can we feed the mother? If you feed the baby, this is one of the big questions. American Academy of Pediatrics very clearly says that even when the mother is taking antitubercular drug and mother can feed the baby. The reason is, what is they say, although it is a popular version that almost all the drugs will, many of the drugs, maximum drugs will go enter into the breast milk and through that it enters into the body of the baby, but their amount may vary, especially in the tubercular drugs, antitubercular drugs, the amount which pass through the breast milk is very, very less. So what I mean to say is, drugs are absorbed through the breast and enter into the breast milk and can be also given to the baby, but their amount may vary. So I will also given this particular one option for drug absorption. Now, another important issue is the disease of the mother spread not through the breast milk, rather due to the close contact. When you go to the general practice, there is always a common version that mother is suffering from cough and cold, can we feed the baby? Okay, so what the normal thinking of the general population is through the breast milk, the infection spread to the mother. It is not like that. Infection spread to the baby. It is not like that. Through the breast milk, the infection will not spread. Okay, through the breast milk, the infection will not spread, but the infection may spread to the baby through a direct contact. It means baby is in close contact with the mother during the time of the feeding, during sleeping, or during nursing, etc. And that may lead to the transmission of the infection to the baby, not because through the breast milk. This is one important issue. Okay. Similarly, one more method of administration of the medicine in children is basti, through the basti, matra basti. The matra basti is that means a child who is selected to take the medicine orally. You can directly go for matra basti. Many medicines can be given to the matra basti, and which we used to practice, and it's quite beneficial in case of cerebral palsy, mental retarded patients, or autism, or ADHD-like conditions. ADHD-like conditions, it is better to go for matra basti instead of forcing the child to take the medicines over a day and then spitting out and so much of wastage. It is better to go for the other routes like matra basti if you want to administer the medicine internal. Next, one more important concept regarding drug administration is the concept of
Sir, excuse me, sir. Sir, kindly off the full screen option.
Okay.
Okay. Thank you, sir.
Okay. So one more method of administration of the drug is that is ahara. That is, Kashyapa rightly says, Kashyapa explains ahara as Mahabhaishya. So we have to understand this ahara as Mahabhaishya in a wide perspective. Okay. So ahara should be modified just like a medicine. This is the important trick that we have to play when we are administering the medications to the children. So ahara should not be only limited to fill the stomach or belly. Rather, ahara should be very, very in an intelligent way. Ahara should be modified as well. For example, fermented items. Now we have got so many fermented items. Fermented items. What is the beauty of fermented items? Is number one is they are very tasty, and number two is they are easily digestible. Number three, they will act as probiotics or prebiotics. Okay, and number four, they helps to helps in the maturation or development of the intestinal bacterial flora. So what I mean to say is atypical intestinal problems. There are many atypical intestinal problems. It can be simply cured by administering certain food materials which can get fermented. So you make the food medicine, make the food get fermented and administered. That itself solves so many of the problems. So we have a different example. For example, in South India, it's of dosa, idli, and in North India again the dokla. So these are the fermented food items. So instead of loading the medicine, you just give some of the fermented items. So many of the atypical intestinal problems will going to subside. Okay, that's one thing. Next, nutritional deficit. See, many of the disorders are simply because of the nutritional deficit. So that can be corrected simply by fortification of the food. Fortification of food is very important. Now, a child coming with a loss of appetite, or child is coming with a loss of weight and failure to thrive, all these conditions, instead of loading the medicine, you can make a very useful so that the calorie output of the total combination will be more. For example, child is having inoculation and you want to give 3 times 1 glass of milk 3 times per day. Okay. Now just think 1 glass of milk, plain milk when you give, the total amount of the calories available is very less. Instead of that, you take half glass of the milk and that will be added with some fat, for example, in the form of MCT oil, medium chain triglycerides, or add 1 teaspoon of protein powder into that milk. So add 1 to 2 teaspoons of sugar, add 1 teaspoon of badam powder, and your ground nut, crush. You add it and give this half glass of the milk. So can you imagine the calorie of the food? When you are giving when you are giving plain milk, the calorie is almost negligible. But when you are giving a half glass of the milk, it is added with all these things. The total amount of the calorie is more than 2,000. Okay, just one example I am telling. This is how we can modify the food as the medicine. Okay, there is no need of giving so many tonics and so many other medicines to increase the weight of the baby or nutritional demand of the baby. Just follow a very simple method. So nutritional deficit can be corrected by the fortification of the food. Now, when the child is having anemia, everybody we know that citrus fruit can be given. Okay, so citrus fruit can be given in the form of the juice or in the liquid form. It can be given. Now, when you know that there is a vitamin deficiency, yes, germinated grains can be given along with the food. That also very good thing. Now, when they say cough, sputum, and upper respiratory tract infection, so different powders can be made into chutney, sweet chutney, and that can be administered with the jaggery or with the honey. So that is quite possible. This is how I am explaining the medicine can be given along with the food and ahara can be modified. Skin problems, of course, everybody we know that skin problems basically the bitter drugs, that is pitta and kashaya rasa drugs, they work very well in the skin condition. But bitter drugs and the kashaya rasa drugs is quite difficult in children. So one of the best way what we can make is mix these bitter drugs or kashaya rasa drugs, you learn the sweet like jaggery and some other things and make them chutney and then you give it. This is also possible. Many liver tonics, again, the pitta rasa drugs are again, they're also very good liver tonics. They are good. So the leaf of different pitta and kashaya rasa drugs can be added to the food preparation. So usually when we prepare manda or peya, in South India usually when they prepare the rice gruel, they used to add different leaves to that. What happens is on adding these different leaves which are having the kashaya and the pitta rasa, so that will be given to the medicinal properties are get imported into that fluid, and that fluid in the form of manda and peya is consumed. That is also another popular way. In many digestive problems. Again, the idli prepared with the leaves, so this is again practiced in many areas. In different digestive problems, there is no need of medicine. Instead, you can go for simple things. So when you prepare the idli, you just wrap it with different leaves. So we know we prepare the material, that is the batter for the idli, and that batter has to be tied. Okay, it is covered upon the leaves of a haridra, tejopatra, kadali patra, vata patra, etc. Okay. So you just take the vata patra and cover and then just wash it and over that put the batter and keep that idli for get boiling. And this idli after boiling, what happens to get the property of this particular leaf? Okay. So vata patra patra, that is whenever acidity increases, usually the idli wrapped with the vata patra is used. Okay, similarly, haridra, that is very good for the skin problem. Tejo patra or kadali. Kadali is very commonly used. But apart from that, haridra and vata patra and different other patras which are having particular properties are used. So, a very simple modification we have done. So, this is how ahara can be utilized as a medicine. The stock of different drugs. For example, Shrinidhi K Acharya or different stocks are there which are very good in different disorders. Yeah, you can take the bark of that and you put it on the right gruel when it is boiling. Okay, this right gruel will give the properties and that can be used. And one more important thing is the drugs are added in tirtha. That means we know that after the religious performance, puja and all, there is a custom of giving tirtha. Tirtha, that means whatever abhisheka we will do for the god, so that water is get collected, tank of water is get collected, and that is given as tirtha. So usually the meaning of tirtha contains actually 8 drugs. Okay, it should be there. 8 drugs should be there in the tirtha. So just like tulsi should be there, then lavanga, then karpura, like 8 drugs are there. So even this tirtha is also acting as a very good antipyretic. Yeah, I want to give an example. When I am very small, it means in my childhood years, actually I belong to a very traditional Brahmin family. In our home, daily there will be puja and all is there. And after puja, we used to give the tirtha. And many people comes to collect that tirtha. Okay. So the complaint of those people who are coming is that they are suffering from fever, so they are coming to our home to have the tirtha. And they believe that by taking that tirtha, so the fever will going to subside. And many times I have witnessed that. So they come with a good result. The fever is subsided. Of course, it may be some part is because of the Yoga Chikitsa and some part is because of the effect of the tirtha, because tirtha contains 8 drugs. 8 drugs are there, which are strong aromatic drugs like for karpura, lavanga, tulsi. So 8 drugs will be there. So this is one of the ways of modification of the drug. I'm just giving an example how we can modify the administration of the medicine. Then one more method of ahara acting as a medicine is if you just follow the traditional eating habits. Especially, I don't know much about North India, but in South Indian meals, if you see, the traditional nowadays it is disappearing. That's an unfortunate issue. Anyway, but if you see the tradition, there is a traditional way of having meal. It is also explained in Ayurveda. So first you have to take the Madhura Ahara, then you have to take the Amla Ahara, then you have to, at the end you have to take the Kashaya Rasa. So that at the end we will have Takra. So in the beginning we will have Payasa. Okay, in between we will have Sambar and all those Amla Rasa drugs. So this particular, the traditional eating habits of the South Indian meal is also act as a medicine, because we know that it pacifies the Vata, Pitta, Kapha in an order, and therefore it is helpful. Now, this is one part. Apart from that, now you go to the next part, that is administration of the Panchakarma in children. Now this is the biggest issue in the pediatrician. So whenever you go for Panchakarma treatment, there will be so many questions coming from all of us, just like arrow. How you can give Panchakarma? So what are the procedures? So whether it is a Yogya person or Ayogya person, many things will come. And totally many of the pediatricians we leave that issue. Okay, so but actually there is no need to be so much of panic at this Panchakarma itself, because we can very well administer Panchakarma in children with slight modification. Of course, if somebody goes through exactly with the classical reference very strictly, then it is quite difficult to satisfy them. But ultimately, if you think that the result-oriented practice is very important, then you can definitely do some of the modification in the Panchakarma, and very safely and very well you can administer in children. There is no issue. Anyway, the different opinions of different authors is there. Now, one thing is very important here is concept of Swatantra Bala and Paratantra Bala. In the Panchakarma treatment as far as Bala is concerned, Swatantra and Paratantra Bala, this explanation is given by Chakraparti. So what he says, Swatantra Bala is the one who is not dependent upon the parents for their daily routine activities. Daily routine activities like the feeding and taking bath and other nursing, etc. Child is not depending upon the parents. That baby is called as Swatantra. This is told by Chakraparti. And another one is Paratantra. That child is completely dependent upon their parents for all his basic requirements. So here, Chakraparti says, in case of Swatantra Bala, Nivritta Vamanadinam Bunstvam Paratantratam, when Paratantra is there, then administration of Panchakarma is quite difficult. But when there is Paratantra is not there, Swatantra is there, definitely we can use the Panchakarma. Okay. So alternative Panchakarma is indicated in the science. We know that instead of Panchakarma, very clearly says that Panchakarmas are not contraindicated. So what he says that Nacha Ati Samshodhanam, you should not go for excess. Atirakshamokshanam. So it should be under limitation by looking at the capacity, age and limitations of the child. You have to give it. And there is no absolute contraindication that you should not give Panchakarma in children. It's not like that. Okay, it is only excess should not be given. Okay. Now, alternative Panchakarma is indicated in the science. We know that when the Vamana is indicated as an absolute indication that you are not able to give the Vamana, that can be substituted by the Bhakti. Okay, similarly, when Marsha is indicated, Marshanasya, but Marshanasya cannot be given, then you can substitute by Pratimarshanasya. Similarly, Videchana, of course, should not be given. It is told that except emergency, Videchana should not be given. So, considering all these things, Bhakti is considered as a best medicine. Because in Vamana also you can go for Bhakti. If you are not able to give Videchana, then also you can go for Bhakti. And if Anuvasan Astapana Bhakti cannot be given, you can go for Anuvasan Bhakti. So like this, the alternative options to Panchakarma as mentioned. Therefore, there is no absolute contraindication of Panchakarma. Panchakarma is indicated. Now, as far as Bhakti is concerned, it is one of the very popular methods. We know that. Shishunam, Ashishunam, Bhakti Karmam. So therefore, Bhakti is one of the very popular method and can be very well practiced in case of a pediatric age group. Now, Vamana, that is Shodhana is indicated. The feeding. One more option is if you are not able to give the Shodhana to the child, there is also option that you can go for the Shodhana to the Datari or the mother because Nityameva Nityavechana is explained. Or so many other Shodhana procedures in case of Samyadushti and all, many Shodhana procedures are explained for the mother. That option is also. Now, talking about Vamana in general Panchakarma practice, Vamana many times give a very good result. Number one is, there is a apprehension that giving Vamana is quite difficult in children. No. Giving Vamana in children is quite easy compared to adults because adults will have so many prejudice feelings are there, but children usually enjoy it because before Vamana we also give so many sweet materials, isn't it? Kapakara, Ahara we give, so usually they enjoy. After first administration or the second time when the patient comes, the child may be a little bit scary. Otherwise, the child used to enjoy the Vamana very much. Okay. This Vamana, especially Sadhya Vamana, it can be very well practiced. Sadhya Vamana can be very well be given in case of upper respiratory infection. Where this is one of the most common problems. Because what happens when the patient, the child has upper respiratory infection, usually they will be for contemporary medicines and the CPM preparations will be given. And after giving CPM preparations, what happens is the sputum is get solidified and will stuck there. Until the sputum comes out, the child will not get released. So one of the best methods is you just go for salt water intake. Ask the child to or forcefully give some salt water to the child and forcefully made into vomit. That is Sadhya Vamana. And this Sadhya Vamana will remove all the length of the cough. That is the sputum and the respiratory tract will become patent and child will get instant relief. So we have tried many conditions. Even in case of what you say bronchial okay, mild attacks of bronchial this type of kapha shodhana is quite beneficial. By Sadhyamana method, kapha shodhana is quite beneficial. So children, when we talk, different types of swedas are also in children. Especially you know that patasweda is there, hastasweda is there, etc. are beneficial in children. Now simple swedana in the form of abdominal pain, simple swedana is quite beneficial in the abdominal pain, samakashwasa, productive cough and shirovedana. This usually used to practice or ask the patient to do it in the home. Child has got abdominal pain, atypical abdominal pain, there may be some colicky pain. Go for Svedana, just go for the Patasveda over the abdominal area. And alternatively, for 5 or 10 minutes you do this, and abdominal pain will be released because it is a very simple heat application of the heat is going to stimulate the sympathetic nerve system, and that gives the result. Similarly, Samakashwata condition, Brahaspaindavalisaya is used, applied over the chest area, and this will be followed by the Patasveda. This will be followed by the Patasveda. That also gives a good result. Same productive cough I already explained, doing Svedana in the facial area and the neck area and chest area is also good for the productive cough. This will be followed by Sadhyamana infusing, that is very good. Similarly, this also happens in Shirovedana, mild Shirovedana around the eyes, you will be careful. But when you are giving Patasveda, no much problem. Around the eyes or forehead area, even in case of Shirovedana also, you can go for Sveda procedure. So, Nasya, one more procedure is Nasya. We know that breast milk has got many therapeutic indications like Akshitarpanam, Davanam, Raktapitancha, Akshitarpanam, many things are there. So, breast milk can be used for Nasya. Simple breast milk Nasya is also quite beneficial because of the rogas in children. And also some of the older rogas. Breast milk Nasya is quite beneficial in those babies with a Kukunaka-like condition where we have some nasolacrimal duct obstruction or continuous epiphora. Okay, in this condition, simple breast milk Nasya is also beneficial. We have tried in some much of the patient, but thing is we have to be a little careful and you have to ensure that infant has already achieved the sneezing and coughing as well as the reflex of the hiccup. So once this is there, child already has a very well developed sneezing, coughing and this reflexes, then he can practice. Then Nasya with Katothaila is indicated. Kashyapa very clearly says Nasya with Katothaila should be done in children, not in the small children, of course, little older children. And he says that it should be done forcefully. It should be, otherwise it may lead to so many complications. For example, so he says that it should be done forcefully. It has to be done in children. Now talking about Ashana, then Layapana, Sechana. These are the three important things that what Kashyapa says that. Maximum medicines to the children should be applied in these three forms. So talking about this biochikitsa in children. Now, Abhyanga is the best mode of treatment. You know that Abhyanga can be very well given in children. For example, child suffering from aching pain or inflammatory pain. Then simple Abhyanga by using Nirguni Taila or Mahavishabha Taila is quite useful. Similarly, pain with the tingling sensation when child has got pain along the limbs, and there will be also tingling sensation when Prasarana Taila can be used because Prasarana is a drug. Prasarana is known for its neurological action. The pain with the atrophy, child has got pain and pain is there with the atrophy of the muscles, then Jivaniya Brahmaniya drug should be selected for Mahamashaditana. Then pain may be also due to dry skin sometimes. Suppose dry skin is there. In such condition, Abhyanga can be given by Yashti Madhutela. And when there is pain in the joints like Amot, like conditions, Vishagarpata Taila or Mahavishagarpata Taila can be used. For emaciation purpose, Sakaroga, etc. is there. Or if you clinically diagnose the condition as Sakaroga, then Raj Taila is there. Then decrease the range of movement, suppose. The range of the movement, there is development of the contractures and so many things. That, in that condition, you want to give for the Abhyanga, Sahasrari Taila and Pinda Taila can be used. Now, one of the most common problems in children that is growing pain. Okay, in growing pain, what we have seen, either you can go for Ashwagandha Lakshari Taila or Mahanavara Taila, simply application in the evening hours. So that is also good. Local Abhyanga can be practiced to the chest area. In case of bronchial asthma, Brahat Saindavadi Taila, because in Shwasa and Kasa it is very clearly explained that Lavana Taila should be used. So first you go for Brahat Saindavadi Taila, local Abhyanga to the chest area, and this will be followed by any type of Swerana. So that helps very much in case of bronchial asthma. Of course, mild or moderate type. And these are some of the important things as far as Abhyanga is concerned. One more is Abhyanga can be also done in case of Shiropadesha. See, in conditions of seborrheic dermatitis, after Mundana, if you go for Abhyanga, that is well and good. Otherwise, also Abhyanga can be practiced to the Shiro area, that is Mahamarichadi Taila and Durgurapatradi Taila. These are the two things which give a very good results when you do the Abhyanga in the Shiropadesha, especially for seborrheic dermatitis. As I told already, after Mundana, if you are doing this, is very good. Some of the neurological problems, okay, we have got some neurological problems, cerebral palsy, some other conditions. So Shiravalatela can be used. And suppose mental retardation is there, behavioral problems are there, cognition problems are there, then it is always go for Jyotishmati Taila, Tungadumadi Taila may be used. This can be also used as Shiropichu. If something is not possible, you can also go for Shiropichu. Similarly, cognitive problems and memory issues, lack of concentration, cognitive problems, then Brahmi Taila is there. Himasagara Taila is there, Tungadumadi Taila is there, they are also very good. Narikela Taila is also considered. See, even in case of seborrheic dermatitis, like condition, simple massage with the Narikela Taila is also good. Narikela Taila, we know that it is indicated in case of Jalashishaka Roga, along with Vishna Avaga. Vaishnav is now very clear, this is Narikela Taila. So that can be used. Then, talking about Abhyanga of the facial area, sometimes in the facial area there will be some fungal infections leading to white patches. In those conditions, Yashtamata Taila and Chakramata Taila, just Abhyanga, mild Abhyanga is quite beneficial. So Abhyanga in case of skin patches, suppose some skin problems are, for example, Shipra. Again, the local Abhyanga of Basuti Taila, Kutaja Bija Taila, that is also good. And one thing is in case of Shipra, patient is asked to expose to sunlight after application for 10 to 15 minutes. Then one more commonly used Abhyanga, that is Abhyanga over the abdomen, especially in neonates. Many of you might have been faced this problem. Usually neonates will have unincolic problems, the atypical colicky pain will be there and used to cry always. So one of the most common procure methods, which is commonly practiced, is you just take ghee, and ghee has to be mixed with a little amount of hingu, and then it is applied externally over the abdomen area around the navi and gives a circular type of movement. Okay, so that instantly really gives a relief in many conditions. Of course, how it works, number one is the abdominal pain is mainly because of chronic abdominal pain. Number one is when you give the Abhyanga, so that displaces the air from the side. Number two, hingu is basically a Vatanuloman substance or Vatanuloman drug. So hingu has got a strong aromatic smell. Of course, I cannot say that when you apply the hingu to the abdominal area, it will get absorbed and do actually. It's not like that. Probably on the application, what happens is the strong aromatic smell of the hingu will be grasped by the baby, and the smell is doing gandha. Gandha is doing some action of Vatanuloman. But often this gives a very good results. Administration of biotics in children as a Shiropichu. This is an alternative to Shirodhara, as we know. This is an alternative for the Shirodhara. You can go for Shiropichu because the administration of Shirodhara is quite difficult in case of children because of limitation, posture limitations, and sometimes can cooperative and all those issues. This can be substituted as Shiropichu. Especially it is quite useful in case of degenerative disorders, neurological and cognitive disorders of the brain. Okay, after Mundana Samskara, if you are doing it well and good, Shiropichu can be substituted by Shirolepa at times. Sometimes it can be also substituted by the Shirolepa. Shirolepa also major drug is quite good in case of cognitive disorders. Even fungal infections of the scalp area. Also, the Shirolepa by using different drugs like Amalaki, Vata, etc. So, Tikshna and Ushna drug, Krishna and Ushna drugs, for example, Vacha, Pipali, Jatamansi, Krishna Ushna drugs. So along with the Gomutra, this is quite beneficial after Mundana, again after Mundana, in case of autism. Okay, in autism, we want to stimulate the sensory system because in autism there is a sensory block. So that can be done. Shirolepa with the Shita, Madura and Snigdha drug, the best practice in case of ADHD. The ADHD conditions, the same can be given with the Shita, Madura and the Snigdha drug. Now one more concept is Shirolepa by using Majja. So Shirolepa by using Majja, you can take the Majja of different animals, or you can take the Majja of Viritaka, Aragada or Ballataka for Majja. Of course, about Ballataka and Aragada, I don't have much experience, but I have experience with animal Majja. You can take the animal Majjas and apply for the Shirolepa area, and it is even taken inside, internally also can be taken. And this has got some good results in case of cortical atrophy, because Majjam Majjena or the thing. So that's the principle. When we substitute Majja in a different way, the Shirolepa Majja will go into replenish. That's the idea. Administration of biotics in children as Lepa. So this part we have already covered. Shirolepa can be extended. Mukha, there are different lepas in the form of Mukha lepa. Mukha lepa is quite useful by using Enavigana lepa. This is quite good in case of facial problems. And Yashtimaru and Amalaki lepa for this Padmini Kantaka or Yuvana Pedaka, etc. Then lepa was the oozing of the skin patch. Then that's again, a skin patch is there, skin lesion is there, there is oozing. Then we need to go for the lepa just like the Shanga lepa or swelling is there. Then lepa over a dry skin patch, we have to use the lepa of the Madhurasa drug. The lepa on the reddish patch, Manjishtari lepa is good. That means whenever there is involvement of the Pitta and Rakta, Manjishtari lepa is good. Lepa in case of macules, Shitra. In case of Shitra, we have got a lepa which is called Ganalinda lepa, which we practice and with a very good result. Putikadi lepa, Ganalinda lepa. Okay, so this is quite beneficial. Again, patient is asked to expose to the sunlight after application. Lepa in case of streptococcal and atypical bacterial infection can be, again, the Shanga lepa-like condition, drug can be used. The lepa, the modified form of the lepa, that is Pattabandhana, can be used. Pattabandhana is nothing but the lepa is applied in a thick way, and the lepa is applied over a thick cloth, and then that cloth is tied around the limb which has undergone the contraction. So in those conditions where there is contractions and deformity, this particular lepa can be modified into Pattabandhana. Okay, so because in lepa you cannot keep it for a longer time because it dries up. But when you go for Pattabandhana method, you can tie up for the maximum time. Okay, that's the benefit. Now, Avagaha and Parisheka, this is one more method of administration of the medicine in children. Avagaha and Parisheka. Most commonly in skin conditions, we used to follow this. It gives a very excellent result. And we know much of the drugs, like we simply go for Nimapatra Kashaya and go for Avagaha and Parisheka. In many of the skin problems, it gives an excellent result. Okay, most commonly, the wet skin conditions with the oozing of the fluid, blood and itchy area is there, suppose. The Nimapatra Kashaya is used. Okay, Panchavalkala Kwata Kashaya can be used. And if you add with the Spatika and Thankana, okay, because when the oozing condition is there, Spatika and Thankana both will absorb the water. In oozing conditions, it is quite good. Suppose the skin conditions are dry, then we have to go for the Avagaha and Parisheka by using Madhura, Shita and Snigdha drug. For example, Dashamula and Balamula Kashaya, Aragada Kashaya. So these are the drug of choice when the dry conditions are there. Okay, now Aragada Kashaya is usually given because of Shita. Now prepare the very simple thing. Prepare the kwata, fill it in a tub with a lukewarm, make the baby sit for 13 minutes. A small kid of 1 year or 2 years, so sitting on the tub and enjoying with the kashaya, usually child used to enjoy. So the easy method is make a tub full of kashaya and ask the child to keep inside the tub and have a pleasant time. Child used to enjoy it, and we can also meet our purpose. One more important thing is Gomutra Avagaha. Gomutra Avagaha, in those conditions, the Shrotovoda of the Shredavaha Shrotas is there. Then the simple Gomutra Avagaha gives very good results. We have tried in 3-4 patients, even in Hassan and also in Jaipur. And Gomutra Avagaha, only thing is you should have abundant Gomutra. Suppose those who are coming from the village, they will have sufficient amount of Gomutra, no problem. So what happens is, especially in dry skin conditions like crushed scales, and we have got a very promising result in case of ichthyosis. In case of ichthyosis also, of course, we know that ichthyosis condition is a recurrent condition. We have to go for a continuous treatment, but it gives good results. It may be something, but it gives good results. Gomutra Avagaha. And this particular Gomutra Avagaha for the first time was I learned this from first time by Dr. C.H. Shassis. C.H. Shassis used to do this, and in one patient in Hassan, sir told me we can go with the Gomutra. Then in a case of patient of ichthyosis, and when we practice that, when administer Gomutra Avagaha in a patient for 15 days, we got tremendous result. Now this is about the Abhyanga. I will not go in detail. And again, this point I want to highlight. This is Agnilepa Chikitsa. This is also part of Agnilepa Chikitsa. This is most commonly practiced in South India. Actually, this is commonly practiced in Ankola Paralysis Center. There is a paralysis center in Karnataka, North Karnataka, Ankola, Maharashtra border. And then they used to treat the paralysis patients, and in a traditional method. And there they use a typical method of Agnilepa or Agni Chikitsa. And this practice was adopted in SDM Ayurveda Udupi by our respected teacher, and used to practice for all the neurological conditions. Okay, so what is this Agnilepa or Agni Chikitsa? It's a very simple thing. It is usually done because of Shodhana, and the main purpose of this Agnilepa is Deepana, Pachana, Agnivardhana, and Amanashaka. Okay, this is the purpose. So we know that in all the conditions there will be Ama is always there, and there is also need of Agnivardhana, and Deepana Pachana has to be ensured. So we can also go for this Agnilepa, especially paralysis or palsies and other spasticity like conditions. This is a very good result. So what is this Agnilepa Chikitsa? Actually it contains mainly 10 drugs. It contains some of the wet drugs and also some of the dry drugs. What are the wet drugs? Yeranda, Nimbundi, Agnimanta, Vanatulasi, and Bandaka. These are the wet drugs, 5 wet drugs. Then dry drugs which are present as Lashuna, Haridra, Lavanga, and Sarshap and Maricha. Okay. So like 10 drugs are taken, they are mixed well, and their paste is prepared. And this paste is applied all over the body. All over the body. Okay, clearly you can apply some oil if you have a doubt of some irritation and all. Otherwise, if the patient is habituated, no problem. Apply all over the body and left as it is for 24 hours. For 24 hours, just leave it as it is. Okay, and some amount is also given for eating. And the idea behind this is it helps to clearing the shoulders and remove the daily correction of the armor. So therefore, this is also one of the best way that we can practice in children, especially in case of cerebral palsy, DMD like conditions where the profound armor is there, so we can go by this methods. Now, different types of Svedana procedures can be practiced in children, especially these are the Kola, Sulasadi, Pinda Sveda, then Spatika, Shashtisha Pinda Sveda, Chuna Pinda Sveda, Valuka Sveda, Dambira Pala Pinda Sveda, Patra Pinda Sveda. So these are the common things which can be used. Now, Upanaha Sveda, Salvana Upanaha Sveda. You know that Salvana Upanaha Sveda, Upanaha mixture, it is very rich in salt. Salt is the Kapahara. So, Upanaha mixture contains carbonate, Vatahara Dravya, Amla Dravya, and Anupamansa, Sneha, Lavana, etc. This helps in relieving the pain. In all the Kapata conditions, Vata Kapata condition, this Salvana Upanaha Sveda is quite good, especially it helps in relieving the Sankocha, which is spasticity. Okay, and even in case of Kevala Vata Yoga, also it is good. Similarly, Pinda Sveda, we have got different types of Pinda Svedas which can be used in children. Jambira Potali Sveda. This is quite useful in case of muscle cramps, avabhava, stiffness of the joints, etc. In Patrapinda Sveda, we know that Katishula, then joint contractors, stiff joints. Danya Potali Pinda Sveda, I will not go in detail. This is one of the, in South India, especially in Kerala, this is practiced, the Danya Potali Pinda Sveda in painful conditions. Chuna Pinda Sveda is also practiced for all Vata Kapha disorders. Now, this is one important thing, especially for the neurological disorders. For example, spasticity like condition in case of cerebral palsy and all. Cola Kulatari Portalis Sveda. Cola Kulatari Portalis Sveda. See, these are the drugs which are used there. Kola, Kulata, Amrataru, Yawa, Nishi, Masha, Atati, Kushta, Rasna, Tailafala, Narikela, Sarshapa, 16 part of Amla Kanji. Amla is very important. Kola Kulatari Portalis. Amla especially acts as Vatahara and Kapara. So liquid is evaporated. So you have to take all these drugs and it is boiled. If liquid is evaporated, the paste will remain there in the bottom. That has to be taken. That has to be grinded well, and then it is applied all over the body. So that is Kola Kulatari Potari Swela. This part I will know. So now, this is some of the important things. Now talking about multiple, some of the important drugs which can see, instead of the Eskimo is usually taken very well by the children. They don't have much problems. Although sometimes it may cause vomiting sensation, but children usually can give Eskimo. Take Eskimo. Such Eskimo has to be used in maximum conditions because we have got the palatability issue is there. See, Eskimo is very good for the drykers. You know that. Same Eskimo is also good for the productive cough because it is kapachelka. And Eskimo is also good as a mild vamanopada. Okay. In so many speech problems like stuttering, Eskimo application over the tongue, dorsal area of the tongue is also good because Eskimo is also Swarakara, Varanya and Swarakara. Then change the phonicity of the voice. Again, you know that. Eskimo tune is quite very good, the major sign. These are multiple conditions where single drug can be used. Fungal infection. In many fungal infections of the face, scalp, and other parts of the body, Eskimo Thaila is very good drug. As a best Rasayana, Eskimo Rasayana can be used, and Vayastava can be used. Eskimo is also very good immunomodulator. Eskimo can be used effectively in case of autoimmune disorders. Eskimo Rasayana. Okay, so Eskimo can be used in hypo and hyperpigmentation of skin because Vernia properties are hypo and hyperpigmentation of skin, it can be used. Then I think these are some of the things. These are the things we already know. I will not go in detail. I think with this I conclude. Thank you very much for giving me this opportunity. Thank you very much. Over to you, Sarita.
Thank you so much, sir, for very insightful presentation. Now the topic is open for a discussion. If anybody have any doubt, they can ask the question to the sir. Close. Now the topic is open for discussion. If anybody have any doubts, they can ask to the sir.
Sir, namaste.
Namaste, sir.
Namaste to Shrinidhi, sir.
Sir. Yes, sir. You can directly speak.
Sir, myself, Dr. Vidyabhushan Pandey, your student. I just want to ask some questions regarding the doses related to the neonates. What should be the procedure should we follow during the drug administration to the neonates for starting since the birth to at least 6 months? As we have seen that Yog Ratnakar and Sharangdhar, they have given from 125 mg or one pinch. So, what is your experience regarding that? That I want to ask, sir.
Hello, sir.
Hello.
Hi, Shrinidhi sir.
Shrinidhi, sir.
I think sir has network problem, sir. Sir has left the meeting.
Okay. I throw this question to the open discussion. During the uh, during the neonate stage, during the infant stage, especially, what happens? We have problem of choosing of the drug, especially in the neonates when the children are when the neonates are from 1 to say 6 months. We have problem in giving the dose, giving the drug. So, can anybody some throw some light on this question, please, or some experience regarding that? Thank you. क्वेश्चन समझ में आया? मेरा सवाल लोगों को समझ में आया क्या? नहीं समझ में आया तो मैं हिंदी में भी बोलता हूँ. मैं ये पूछ रहा हूँ. हेलो. हेलो. मैं एक बार हिंदी में भी इसको एलेबोरेट कर देता हूँ. हमें ज्यादातर प्रॉब्लम होती है, हमारा पीडियाट्रिक एज ग्रुप 1 साल के ऊपर बहुत इजी वे में ड्रग एडमिनिस्टर कर सकता है और देयर आर सो मेनी ड्रग्स प्रेजेंट. बट जब हमको नियोनेट्स के अंदर, खासकर इन्फेंसी में जब हमको ड्रग्स देनी होती है, तो वी फेस सम प्रॉब्लम्स रिगार्डिंग द ड्रग डोजेस एंड फॉर्म्स ऑफ द ड्रग स्पेशली, जहां पर हमको क्या क्या फॉर्म्स में यूज करना चाहिए. जैसे अभी सर ने बताया अभी कि भाई लेप करना चाहिए ब्रेस्ट पर. तो मैं एक्सपीरियंस पूछ रहा हूँ लोगों का, जो लोग बहुत ज्यादा ऐसे केसेस को डील करते हैं, प्लीज अपना एक्सपीरियंस शेयर करें. ड्रग्स फॉर्म्स कैसे यूज करना चाहिए, आयुर्वेद ड्रग फॉर्म्स स्पेशली, क्या डोजेस लेनी चाहिए, क्या हमें जो क्लासिकल फॉर्म्स ड्रग डोजेस दिए रहते हैं, जैसे एक एक रत्ती बढ़ाना 125 mg, और इस तरह से जो शारंगधर योग रत्ना करें, वो फॉलो करना चाहिए, या फिर और कोई इसमें आपका एक्सपीरियंस हो, प्लीज.
Sir,
हाँ विद्या.
can we use the Arka
तो
form also? That is one option.
हाँ विद्या.
ओके मैम. यस
हाँ
बॉस.
मैं दे रही है. हाँ
हाँ बॉस, आवाज आ रही, बहुत धीरे है, थोड़ा सा तेज करेंगे.
हाँ हाँ. अब सुनाई दे रही है.
हाँ अब अच्छी है.
हाँ. तो क्या है ना कि इसमें देखो, यूजिंग द टेक्सचुअल guideline for the pediatric drug dosing is very much difficult, है ना. So what we use in our pediatric practice, the same formula that we learned in our NIA tenure, कि
Yes.
तो इसमें whatever the adult dose is indicated according to the कषाय कल्पना, है ना, that according to that we are selecting, we are giving the per kg body weight in the neonatal period also. For example, if we are providing some syrup, है ना, तो syrup, then we will go for the कषाय कल्पना adult dose 50 ml, है ना, or like divided by 50 approximately. Typical dose also will come up approximate 1 ml per kg per day, है ना, that you can divide in BG or TDS. For example, if baby is 4 kg, right? So we can, if depending if drugs are pre-Shushna, then we can make it 0.5 ml 0.5 ml per kg per day. Okay. अगर 5 kg का बच्चा है तो 2.5 ml in whole day. Divide it in 3 times, so it will come almost 0.8 ml 0.8 ml TDS, like that syrup form. और यही अगर चूर्ण फॉर्म में हम करते हैं तो अगर फॉर एग्जांपल 125 mg किसी की डोज है, किसी स्वर्ण किसी भी मतलब जो भी हम रस औषधि की ले सकते हैं, तो दैट विल बी ऑलमोस्ट 4 to 5 mg पर केजी पर डे, राइट। तो इसी तरह से हम जो हार्मफुल नहीं है, मतलब जो तीक्ष्ण उष्ण नहीं है या फिर जो हैवी मेटल्स वाली नहीं है, रस औषधि नहीं है, उन्हें एक जनरल प्रिंसिपल अप्लाई करके एक प्रैक्टिकल डोज बना सकते हैं। तो ये तो हो गया एक प्रैक्टिकल अप्रोच। उसके बाद देयर इज अ नीड ऑफ डाटा कलेक्शन of the therapeutic dose, right? कि we cannot we cannot calculate the therapeutic dose actually practically unless until कोई pharmacological study जब तक ड्रग की नहीं होती है ना, तब तक हम करेक्टली थेरेपेटिक डोज को कैलकुलेट नहीं कर सकते। लेकिन वी कैन फाइंड आउट द थेरेपेटिक डोज ऑफ आवर आयुर्वेदिक ड्रग्स, लाइक कि तुमने प्रैक्टिस किया, देखा कि बाल चतुर्भद्र चूर्ण अगर इस मात्रा में देते हैं तो इट इज बेनिफिशियल, एंड उससे ज्यादा देते हैं तो वो पैलेटेबल नहीं होता है या फिर कुछ और साइड इफेक्ट्स आ जाते हैं। तो that type of data collection practically is important from different pediatricians, like है ना, सबसे एक तरह का ऐसा थेरेपेटिक डोज को कलेक्ट करना केवल, क्योंकि वैसे आइडेंटिफाई करना तो फार्माकोलॉजिकल स्टडी है। लेकिन जब हम जैसे मैंने अभी बताया कुछ उसका कुछ ड्रग्स का जो मैं यूज करता हूँ, जिस तरह से 0.8 ml सिरप पीडीएस में अगर 5 kg का बच्चा है तो इस तरह से मैंने अपना डोज कैलकुलेट कर रखा है, तो उस तरह से मैं देता हूँ। और अगर मैं उसे इफेक्टिव पाता हूँ तो दैट डेटा शुड बी कलेक्टेड फ्रॉम मी एंड एज वेल एज फ्रॉम यू, एंड वो एक थेरेपेटिक डोज का, पीडियाट्रिक थेरेपेटिक डोज का एक प्रैक्टिकल डाटा कलेक्शन करके एक थेरेपेटिक डोज का कलेक्शन इम्पोर्टेंट है। मतलब ये एक बहुत ही पर्सनल है, क्योंकि कहीं पे भी ये ऐसे दिया नहीं हुआ है। तो जस्ट इस तरह से हम करें तो एक प्रैक्टिकल अप्रोच थेरेपेटिक डोज को मिल सकती है। हाँ विद्या।
हाँ बस बिल्कुल सही बात है। वैसे बस ये भी बोलूंगा कि जहां तक जो सारंगधर और योगरत्नाकर की ड्रग्स दिया हुआ है, जो डोज फॉर्मेशन दिया हुआ है, 1 साल तक चूर्ण के केस में जो बहुत तीक्ष्ण औषधियां नहीं है वहां तक ये काम करता है। उसके बाद जरूर वहां पे थोड़ी बहुत परेशानी क्रिएट होती है। तो जहां 1 साल तक मेरे ख्याल से जैसे आपके पास दवाएं हैं, सीतोपलादी चूर्ण, तालिसादी चूर्ण और इस तरह के वो ड्रग्स जिनमें बहुत तीक्ष्णता और कटुता नहीं है, वहां आप वो 125 मिलीग्राम की डोज को लेके चल सकते हैं 1 साल तक। उसके बाद जरूर थोड़ा सा प्रॉब्लम बढ़ती है। तो 1 साल तक की एक समस्या होती है। वहां तक जितने भी हमारे स्टूडेंट्स हैं दे कैन यूज द ड्रग्स। और जहां तक ड्रग फॉर्मेशन है और जो आपका सही बात है, ये अभी हमारे यहाँ थोड़ा सा लैक जोन है जहाँ पे भी हमको रियली डाटा कलेक्शन करके काम करना है।
और
ठीक है, और मैं और कुछ जी बस।
हाँ, अपने यहाँ एक और चीज है ना, बिकॉज इन मॉडर्न मेडिसिन ओनली वेट इज द क्राइटेरिया, है ना, आइदर सरफेस एरिया और वेट, है ना। लेकिन इन आयुर्वेदिक प्रिंसिपल्स एज आल्सो इज वेरी इंपॉर्टेंट फैक्टर, है ना।
बिल्कुल।
हाँ, तो उस दोनों तरीके से चीजों को एनालाइज करके एक थेरेपेटिक इंडेक्स बनाने की जरूरत है पर केजी एंड वेट आल्सो, बिकॉज द मैच्योरिटी ऑफ ऑर्गन्स डिपेंड्स, एज स्पेसिफिक रहता है ना। जैसे तुमने अभी पूछा केवल इन्फेंसी में, है ना, तो इन्फेंसी के लिए पर केजी बॉडी वेट का फॉर्मूला चल सकता है। लेकिन वही जब 5 इयर्स का बच्चा होगा तो उसका वेट 20 भी हो सकता है और 30 भी हो सकता है। तो उस तरह से हम पर केजी बॉडी वेट में उसे कन्वर्ट नहीं कर सकते, है ना। तो दोनों चीजों को देखना है। इसीलिए तो हमारे यहाँ आयुर्वेद में एज स्पेसिफिक डोज डिफरेंशिएशन भी बोला है, बिकॉज ऑफ द टिश्यू मैच्योरेशन।
बिल्कुल बस एज स्पेसिफिक सुष्टुप पूरी तरह से क्षीरात, क्षीरन्नाद और अन्नाद की ही बात करते हैं डोज को बताने समय। और किसी के पास कुछ सवाल हो तो बताए, नहीं तो मेरे पास दूसरा सवाल है। एनीबडी, कोई और सवाल पूछना चाहता है तो प्लीज आगे है, नहीं तो आई हैव सेकंड क्वेश्चन।
So for newborn, we can use the ARCA form also. The active principles are.
Madam, very fine. You are very nicely said that ARCA form, but availability of ARCA form is very difficult. Otherwise, आप खुद बनाएं तो it is very possible कि आप उसको दे सकते हैं. But market preparations are very less. अगर आप क्या उधर आता हो तो बिल्कुल शेयर करें.
Yes, sir. I share it the group, sir. I know the one pharmacy. They have almost 50 formulations of ARCA only, sir. Uh, I'll give the information in the group, sir.
Very nice, very nice. No question. Then I have again one question regarding Ras Aushadhi. Uh, what is the idea of other people? From what age do we start giving the Ras Aushadhi, first of all? And second question is that what about the Ras Aushadhis which contain some poisonous material like arsenic, like Samir Pannag Ras, like Ras Manikya? Those who want to throw this some of their experience on this question, they are please welcome.
Sir, coming to the Rasaushadhis, I think Swarna Prashana is told from birth itself only. So there is no question of Rasaushadhi using. Definitely we can use it from the birth. And again, if the medicine is properly prepared, we have the confidence on the medicine, and definitely it is useful in the conditions where this all rasamanikas are not used in acute conditions. If the conditions are very chronic, for example, if the TB and all, just I am giving an example. Newborn, we have the TB where you must use the Rasaushadhis. In that case, we can apply, and again dosage we have to fix according to the case. This is what my opinion, sir.
I want to extend some more queries on that. In when you go through the collection of medicines like Ras Ayurved Sarsangrah and other collection areas, you will find some drugs are contraindicated in the children, but they are contraindicated at that time when they are written. Are they practical in this scenario also, or they or some other experiences of some physicians are there? Because I find like after what I seen that Samir Pannag Ras Sindur and this Malla Sindur. Malla Sindur is also very much effective, but when you will go to the Ayurveda Sangra, it is written that it should not be given the children. सो आप लोगों का कोई अगर ऐसा अनुभव हो तो बिल्कुल बताइए, क्योंकि मुझे लगता है कि अभी इसके समय में आकर के कुछ बच्चों को जो दवाइयां देने वाली हैं वो थोड़ा चेंज होनी चाहिए. वो उस समय की बातें हैं, थोड़ा बहुत हिट एंड ट्रायल्स जरूरी है. किसी का कोई अनुभव हो तो बिल्कुल बताए.
अभी विद्या जो है स्वर्ण प्राशन जो इतना एफिकेसी जिसकी देखी जा रही है और बाई बर्थ हम लोग यूज कर रहे हैं, तो अभी अभी इवन उसे जो प्रैक्टिकली हेल्थ केयर सिस्टम में अप्लाई करने के लिए भी अभी भी उस पे जो है वो रिसर्च चल रही है, इतनी एफिकेसी देखने के बाद भी, तो कि वो कहीं वाइटल ऑर्गन्स को हार्म तो नहीं करता है. तो इसमें जो प्रैक्टिकल प्रॉब्लम्स आती है पीडियाट्रिक प्रैक्टिस में, वो मैंने देखा है कि डेटाबेस नहीं है, और सबसे इम्पोर्टेंट ये है कि जब तक कि क्रिटिकल केसेस नहीं हो तब तक सभी पीडियाट्रिशियंस जो हैं, आयुर्वेदिक पीडियाट्रिशियंस, वो 5 इयर्स तक जब तक टिश्यू मैचुरेशन नहीं हो जाता है, सॉरी ऑर्गन मैचुरेशन की स्थिति नहीं आ जाती है, तब तक इन सब को इवन थेरेपेटिक डोज में यूज करने से भी बचते हैं, अवॉइड करते हैं. वो यूजुअली कास्ट औषधि को ही अभी तक इतना फ्रीली यूज किया जा रहा है. बाकी कुछ लोग हैं जो इंडिविजुअली स्पोरेडिक डेटा कलेक्शन हो सकता है, मतलब इंडिविजुअल लोग करते हैं, लेकिन किसी ने अभी तक ऐसा शेयर नहीं किया कि ये सब सिंपल मेडिसिन, जो सिंपल मेडिसिन है, जैसे डिजीज स्पेसिफिक है, लक्ष्मी विलास रस है, रस औषधि, इवन कुमार कल्याणक रस है, या श्वास कांस चिंतामणि है, श्वास कुठार रस है, ये सभी डिजीज स्पेसिफिक तो यूज होती हैं। लेकिन जिन समीर पन्नाग रस और रस माणिक्य और जिन ड्रग्स की तुम डिस्कशन कर रहे हो, ये यूजुअली अभी जो है आयुर्वेदिक पीडियाट्रिशियन के पैन पे नहीं यूजुअली नहीं आती है, जब तक कि क्रिटिकल कंडीशन ना हो, तो उसको अवॉइड करते हैं। मतलब ये इस समय प्रैक्टिस में है, ऐसा मैं बता रहा हूँ।
Sir, I request
ठीक है बस
Reena,
जी।
Reena madam to comment on this question, sir. Because we have seen that in PG, during our PG, usually Reena madam prescribes many rasaushadhis in pediatric practice. So please, I request Dr. Reena ma'am to show interest in this topic. Please, ma'am, put some light on this topic, ma'am. Reena ma'am. Reena ma'am.
Good evening, everyone.
Good evening, ma'am.
Am I audible?
Yes, ma'am, you are audible, ma'am.
Uh, well, there was a good discussion going on, as I think Dr. Vidyabhushan Pandeyji was opining. Like there are some incidences of practice with Rasaushadhas, but thorough documentation may not be available so far in children. But out of experience, we can say that yes, we have used Malla Sindura, yes, we have used Mahalakshmi Vilasras, yes, definitely we have used Rasa Sindura and Rasamanikya also in certain conditions, Shwas Kasa Chintamani, Shwas Kutar Ras, yes, we have used. And we have used without any complications in children. We have used Lakshmi Vilas Rasa as early as from 2 years, 3 years child, and to surprise, such a wonderful drug, when the child comes with acute running nose or upper respiratory tract infection. Simple Mahalakshmi Vilas given in a very dose, maybe quarter tablet or half tablet thrice a day for about 2 to 3 days, you will have excellent results, which you may not see even after using paracetamol, cetirizine or something like that. Such an excellent results we have seen. Similarly, like Malla Sindura, very chronic this one, asthma, childhood asthma, you can definitely use. You can use it as good as a steroid. It has a steroidal effect. And we use these medications not for a longer time. At the most, we use for about 40 days. And we have to just follow certain patya, like certain rasaushadhas when given, they have mentioned that kakara dravyas should be avoided. So these things should be kept in mind. And the dosage should be very, very less. Malla Sindura, if we use, maybe per dose, say if we are using around 50 grams of total combination of chulnas, we use maybe for 50 grams around 2 grams or at the most 3 grams. That means to say maybe per dose you are giving not even 1 rati, that may be 1/4 of a rati or even lesser than that, and that can be utilized for about a period, at the most it is for 40 days. And normally what I use in my practice is for about a week or 10 days. By 10 days, there will be very well control of the clinical symptoms. So we are going to taper. We may continue with the same medications, but this particular medicine would be stopped. So this is the way we are using. And Malla Sindura, as I said, is excellent in case of chronic asthma. And Rasasindura we have used again in acute as well as chronic asthma in the same way. Especially in conditions, if it is Kapha Vata Pradhana, again Mallasindura would be excellent one. And the involvement of Pitta along with this, again Rasasindura would be a choice. And of course, Makaradvaja, Siddha Makaradvaja is our choice of drug in acute asthma. Acute asthma, along with sometimes, with regular medications, if we add this one, Siddhamakaradvaja, we'll have excellent results. We add, it's very costly, to add Makaradvaja tablets, but still half a tablet or quarter a tablet as per the age and the weight of the child. Maybe 2 to 3 days will give excellent results. And in case of chronic skin diseases, uh, like atopic dermatitis, sometimes Vichurchika kind of presentations. We have used Rasamanikya. Rasamanikya is excellent. Sometimes Rasamanikya directly if we are unable to use. Then there is a tablet, Puritin. Puritin, I think maybe Pavman pharmacy or something like that. Puritin tablet has almost 1/4 of the dose which we give for the clinical practice. So that excellent results, especially in wherever Rasamanikya, wherever clay the bahulata is there in case of skin conditions. So this is excellent in reducing the skin conditions because maybe Rasamanikya on a longer usage brings about the rukshata in the dhapus. And this is the reason why Rasaushadhas for a longer period is to be avoided, especially in children. And most of the contraindications are for this reason, either they cause Dhapurukshana or because they have a Ushnavirya and Tikshnavirya and they can be affecting the growth of the Dhapus. This is the reason why most of the Rasaushadhas are contraindicated. Apart from that, we commonly use Pravala Basma, then even Abraka Basma, Sastraputi, Shataputi, Abraka Basma. We very frequently use it, and so far we have not found any adverse effects of these drugs being utilized. At the same time, we had 2-3 patients also. Well, they were from a reputed families where their parents were doctors. And just to have a monitor that Ayurveda physicians are not using any steroids or the side effects of the drug, they were all done. The heavy metal assessments also, along with the regular function tests of the organs. And for even after using continuously this, this Pravada Basma, Swarna Basma, Rajata Basma for about a period of 2 years and 3 assessments with all these things. It was all functions were very normal, and in fact they had a very good feedback. Still, such patients are in follow-up with us. This is what I just can share for this session, I think. Thank you so much for this opportunity.
Thank you
Hope
so
it
much,
is
ma'am.
useful to all.
Thank you so much, ma'am, for sharing your experience with us.
Thank you, madam.
Thank you, ma'am.
Doctor, please, Dr. Sarita,
Yes, sir.
wind up the meeting. Wind up the meeting.
Hello. Hello, sir.
Sir is saying please wind up the meeting now.
Yes, sir. Yes, sir. Yes, sir. On behalf of Jiva Committee, I deem it a great honor and privilege to propose the vote of thanks on this event. Despite of busy schedule and sir health condition, sir has found time to present in the Jiva Committee. And sir has presented very insightful topic, and it was very needed and very important topic for all of us. Thank you so much, sir. As sir has messaged that sir is also having one more meeting, so sir has left this meeting. Thank you so much, sir. My heartfelt thanks to all the respected teachers and PG students for their valuable presence, and I owe my special gratitude to all the members who are responsible for this event. Thank you one and all. Good night, everyone. Now I am going to end the session. Thank you one and all.